Hello everyone, we have learned the basic actions of medicinal substances. Today we'll study superficial relieving drugs, which we call them diuretics as well. Diuretics are the drugs that can disperse exogenous pathogenic factors from the superficies of the body and relieve exterior syndromes through perspiration. These drugs can expel and disperse exogenous pathogenic factors from the superficies of the body. Clinically, usually used for exterior syndromes due to invasion by pathogenic excesses, such as common cold, cough, edema, and other diseases with simultaneous exterior syndromes. All diuretics are with a pungent taste. Drugs with a pungent taste can cause sweating, as we know, and some drugs also have a bitter taste, which can eliminate dampness. Some drugs, warm in property, can dispel the exogenous pathogenic factors of wind and cold from the superficies of the body. We call them pungent warm diuretics. Other drugs, cold and cool in property, can dispel the exogenous pathogenic factors of wind and heat from the superficies of the body. We call them pungent cool diuretics. All of the drugs in this category act on the long meridian and are ascending and floating drugs. As for toxicity, there are only two kinds of drugs in this category. One is wild ginger, the other is cocalbur fruit. Combination of ingredients refers to the combination of more than two drugs in a prescription in order to produce desired therapeutic effects and reduce toxic or side effect. The pathogenic factors of wind and cold are common in winter and wind heat in spring. In summer, there is more dampness and summer heat, and in autumn there is more dryness. It is necessary to combine with the drugs to dispel summer heat and dampness in summer, or the drugs to moisten dryness in autumn. And if it is exterior deficiency syndromes, we need to replenish or tonify qi, blood, yin and yang at the same time. At the beginning of a febrile disease, detoxifying febrifuges should be combined with. Some diuretics have strong sweating effects, so we should avoid sweating too much. The choice of diuretics needs to be based on season, environment, and body constitution. It is necessary not to boil the decoction for too long because diuretics usually contain volatile oil. Pungent warm diuretics, pungent in flavor and warm in nature, usually have strong dispersing actions and are used for treating exterior cold syndromes marked by severe cold and slight fever, that means more chillness than fever, and a thin white tongue coating, as well as floating and tense pulse. With strong sweating effects, pungent warm diuretics in clinical practice should be administered cautiously to the patient of weak constitution. Representative drugs are ephedra, Chinese cinnamon twig. Pungent cool diuretics, pungent in flavor and cold or cool in nature, usually have comparatively mild dispersing actions and are used for treating exterior heat syndromes marked by high fever and slight cold. That means more fever than chillness, thirst and yellow thin dry tongue coating, as well as floating and rapid pulse. Pungent cool diuretics are often administered in the combination with detoxifying febrifuges. Representative drugs are thoroughworks root and chrysanthemum flower. Today we have learned diphoretics. All diphoretics are with pungent flavor. They act on the lung meridian and are ascending and floating drugs. Diphoretics can disperse exogenous pathogenic factors from the superficies of the body and treat common cold, cough, edema, and other diseases with simultaneous exterior syndromes. Treating exterior cold syndromes with pungent warm diphoretics and treating exterior heat syndromes with pungent cool diphoretics. Avoid sweating too much and not to boil too long in making decoction. I hope that through this class you have gained a basic understanding of diphoretics. So much for today. See you next time. Goodbye.